We continue this series of videos about the shoulder joint, shoulder osteoarthritis. We talked about the causes last time, about which muscles are involved, what happens to the joint, why it stops moving, why all this happens, what is involved in this, and the cervical spine can be the cause of impaired movement in the shoulder joint. Now, here are a few exercises that you can start doing on your own. And, well, to some extent, you will be able to help yourself. Let's start with the calf muscle. We talked a lot last time about how important it is to stabilize the hip and stabilize the foot. For hip stabilization, the calf muscle must work well for us. Here, in about 80% of cases, the cause is in the muscle itself, the places where the muscles are attached, but 20% is a problem of innervation. What I'm going to show now will only help if your problem is specifically in the muscle, not a nerve compression. You won't be able to determine on your own what you have, but try to do this. If it helps you, then you're lucky. And the problem was not in the innervation disorder, but simply in the weakness of the muscle due to trigger points or instability of the attachment sites. Let's start with the subclavian muscle. The subclavius muscle is located between the clavicle and the first rib. The given sentence is incomplete. The clavicle is not quite where it should be. It should be a little higher, and this muscle is located between the clavicle and the first rib. And you can independently affect the subclavian muscle on the places of its attachment, right along this entire surface of the lower part of the clavicle. Just take it and press it like this on your own. Just take your finger like this and press. Find the affected area, press, and either hold it. Position your hand like this so that you feel a slight discomfort, or make a slight movement in one direction, then the other, or some circular movements. It doesn't matter here, the point is to find your trigger point. This is called ischemic compression. That is, you press on this diseased part of the muscle, on this group of fibers, this diseased node, and it gradually begins to relax. So your task is to find the diseased part right under the key, somewhere about the width of a thumb, and act on it. The direction of pressure, like this, that is, straight perpendicular and slightly upwards to the key itself. Right along the entire surface of the key, somewhere at this distance. That is, you act directly on the subclavian muscle, like this. So you find the affected area, and either hold it if you found it, maintain the pressure, or make a slight movement to one side, to the other side, to one side, to the other side. So this is the first stage. The first stage is you removing the trigger points at the attachment site. After you've done this, after you've removed the affected areas, well, for example, it will take you about 3 to 4 days to do this. Then you can proceed to the exercise. The exercise for training the subscapularis muscle. It is trained in this position. The arm is raised. Yes. In short, the arm is raised in this way, and there will be pressure, like this. The arm will move in this direction, approximately to the ear. The elbow should be straight, because if you bend it, your bicep will be working. And all this is done in a doorway. That is, you stand up. In a doorway. I have a doorway right above me. Let's show it better, to make it easier to demonstrate. So this is how I stand in the doorway. I put my hand here and apply pressure for about 3 seconds, then Relaxing my hand, I put the other one here under the key, just to feel how the muscles tense up. I apply pressure and relax, apply pressure for a second or three and relax. Do this only after you have at least slightly relieved these sick points here. You can't do it right away because first your muscle has to engage. This is the gluteal muscle, the stabilizer of the key. The second muscle is the anterior, serrated. This is the stabilizer of the blade. Until it works, no muscles that attach to the blade will work. Neither the rhomboid muscle, nor the middle lower trapezius, nor the subscapularis, nor the supraspinatus will be able to work. And the deltoid will not be able to work properly. Here it is important exactly the places of attachment to the ribs. The first way is to find the diseased parts. Here exactly on these ribs, right here in this gap between the large pectoral muscle and here with the widest muscle. Here, right on the ribs, you will find the diseased parts, also trigger points. And you can press on them. Also press accurately, hold or make a movement to one side, to the other, to one side, to the other. This is in case the problem is simply in the place of attachment. But here most often there is simultaneous fixation of the rib, fixation of the ribs. This can also be removed independently. There is such an interesting exercise. Take a towel or a sheet, fold the sheet so that it is approximately this wide. Or a towel, like this. You wrap it like this. Take one end like this, the other like this. And you take a breath. On the inhale, you pull it, and on the exhale, you relax. On the inhale, as if you resist the movement of the ribs. So you've set the towel like this, hold it, take a breath, pull on the inhale and exhale. On the exhale, you don't do anything. Do 50 to 60 such repetitions. That is, you interfere as if to take a breath. And in this way, you increase the mobility of the rib, that which was fixed. And because of this, your anterior serratus muscle will start to work. All exercises need to be started exactly here. With the recovery of the shoulder joint, you need to start exactly with these two muscles. This is the subscapularis muscle and the anterior serratus muscle. Probably need to show this exercise better. Stop. In general, you do such a thing out of a sheet or take a towel. Wrap it around yourself in this way. Take it at about this level. During the inhale, you pull both ends, about 3 to 4 seconds, and exhale. On the exhale, you do nothing. On the exhale, relax. Take another inhale and exhale, relax. Inhale. Interfere with the lateral movement of the ribs. After this, somewhere after 3-4 days, you will notice that breathing has become easier because the anterior serratus muscle and the intercostal muscles themselves will work better. This is a very effective exercise to increase lung volume, that's all. In the next video, I will show the exercise and how to perform it. The diaphragm, capsule, and sublingual muscle